Good morning, and thank you for attending today's webinar, Numeracy, Health Literacy, and Clear Communication for Numbers and Statistics. I have a few items to review with you before we start. CHESS credits are available for this webinar upon completion of the evaluation at the end of this meeting. Please follow instructions on the screen in order to receive your credits. We want to answer all of your questions during today's session. You can ask questions in several ways. You may type your questions in the chat box, and they will be read aloud during the question and answer period, or you can wait until the end of the presentation to ask them aloud. The operator will provide instructions on how to do this. Though today's slides will be sent to participants, everyone who attends or registered for today's session will receive a link to a recording of the training. Please take a moment to take our post-training evaluation. Your feedback will help us provide you with targeted, high-quality webinars and trainings in the future. Now I'd like to introduce today's speaker. Patrick Harris is Acting Team Lead for Health Marketing and Communication Services at the Centers for Disease Control and Prevention. He is a communications expert with 28 years of experience with CDC. During this time, he worked in many different roles, including but not limited to health communication specialist, social media lead, program consultant, and assistant senior public health advisor. Patrick, I'll turn the meeting over to you.
Well, welcome everybody. I appreciate you all coming to this webinar, both in person as well as our folks here online. So what we're here for today is to talk about what health numeracy is, what it means to our work both as health communicators and our many different roles like I and many of you have held in public health, because this information is not relevant just to communicators, but to anybody who's working with consumers and sharing numbers, data, and similar information. So it's a reasonable question to ask why we're talking about numbers and data as part of health literacy. We're pausing just a moment for a technical issue. Alrighty. So why are we talking about numbers and data as part of health literacy? As in the image that hopefully you see now, numbers and data can feel overwhelming, especially to consumers that don't work with numbers on a daily basis. It's our responsibility to use numeracy principles and plain language in our writing to make the information understandable and actionable. So the real question then is, what is numeracy? Numeracy is the ability of a reader to understand the meaning and context of numbers used in materials that we create, and then take actions and make choices based on that understanding. Numeracy is really not fundamentally different from other plain language and clear writing, but it's often overlooked in favor of precision and nuance, wanting to get that number just right instead of getting the number where it needs to be for people to understand it. So here are a few examples of information as data. Numeracy matters in what we do because CDC uses numbers to express population sizes, numbers of cases, positivity rates, and many other complex, nuanced, sometimes very specific numbers and statistics. However, when sharing messages with consumers, it's important to emphasize clarity and simplicity so that the message does not get lost in the numbers. So what is numeracy relative to health literacy? As its name would suggest, it's a subset of health literacy. It is part of the mix of skills people need to understand the information that we provide. So here's an illustration showing where it fits in the family of health literacy. So it's a subset of health literacy, or in our particular area of interest, public health literacy. But this diagram shows the collection of skills a reader needs to successfully take in and act upon information we provide. So why does numeracy matter? Why are we talking about it here today? It matters in terms of how we write and present information. In our public health role, we aren't charged with improving consumers' health literacy or their numeracy. What we must do, however, is make complex information as clear, simple, and actionable as possible. We want people to do more or less of certain behaviors, so it is incumbent upon us to ensure they understand the problem and what we are asking them to do about it. And it really is as simple as that. We need to keep our data or numbers accurate while also making them easy to understand and for consumers to turn into action. Some of the components of numeracy that we're going to talk about today are for whom we intend the information to reach, what the numbers mean in terms of how we want people to understand them and take action, the complexity and nuance of the data itself, and bearing in mind how people process and think about numbers and data. So shifting gears, here is what we can do to meet people where they are in terms of their numeracy skills. Since we don't know what the reader knows or understands, we want to write in such a way that we can make it understandable for them. We must consider for whom we are writing. A scientific article, one that's peer-reviewed, published in a journal, can be packed with dense, complex, nuanced information because the audience, fellow scientists, are prepared in terms of reading and numerical literacy. Consumer audiences, however, need a clearer, streamlined version of that information to make informed choices. So when writing for consumers, we must keep in mind that the framing or context will drive thinking and conclusions about the data we share, so making certain that the purpose of the sharing, whether it's information only, stop doing X, start doing Y, do more or less of Z, is clear to the reader. So we need to ensure that the data represented supports the message and is presented in a clear, concise way. Because if we are asking people to do more of something and the numbers suggest they actually should do less, that's going to cause confusion on the part of the consumer. So framing matters. We can't expect people to take action if we don't have a reason ourselves for sharing the numbers and data in the first place. We need to know us before we can ask others to understand us. So we must consider how people will think about and process the data. You can hear them thinking as they're reading. What does it mean? Does it apply to me? How does this affect choices that I'm going to make in the future? Some data can be made clear, simple, and concise, easily lending itself to use by consumers. But some data may be too complex or too nuanced to be rendered useful for consumers. I'm sure we've all seen at one point or another a study that has this population in this city over this time, and it ends up being a sub population, and that may be too complex to ask a consumer to follow through and understand. So how we present that is going to be important for people to be able to take it in and then turn that into action. And some data may be at the stage setting process, really not useful for consumer application, but worthwhile for other scientists to use as a jumping off point for further research. So also consider that large numbers can be numbing to people. They can't understand a very big number and what it means for them. People can only experience empathy for small numbers. 30,000 people that die from a natural disaster is really not comprehensible for people. But if you hear about a family of 4 dying in an automobile accident, for example, that's digestible, that's understandable and relatable. You can picture a family you know, or God forbid your own family in that situation, but it's very hard for people to picture 30,000 people sick, dead, or dying. Excuse me. It's just too large a picture for people to take in, so relatability is key for us. So when we're writing tweets, fact sheets, web content, blogs, and other materials to share with the consumer audience, and that is at the county level or the national level, we need to frame the data with clear, plain language messaging and numbers to support them that are designed to move consumers to stop or start what they're doing, or do more or less. So, just like I was talking about before, we have to bear in mind that the numbers must be human and relatable. Data that is too large or too abstract will not move people. So the $10,000 question, how do we do it? What does it look like, and how can we make that real in the work that we do? Percentages, for example, especially with decimals, are less consumer friendly. So when possible, we should move numbers and data into a format that is more relatable. 25.7% of people have W, as it says, is much less, again, relatable and human than 1 in 4. As you look around the room where you're sitting now, or the next time you're at a table with friends, think about 25.7% of them versus 1 in 4. It's also about making it concrete, not just relatable, but real. If you tell somebody they have a 33.2 or even just a 33% chance of something, it's not as meaningful as saying you have a 1 in 3 chance. I mean, if you're in a place, you look to your right, you look to your left, in theory, that means that one of you is going to experience what we're talking about or the information that we're sharing. And that's much more immediate. There's actually an example that Steve Zuckerberg used years ago saying that people, at least on Facebook, are much more interested in what's happening with the squirrel in their neighbor's yard than they are about something big happening in a country that's far away, because it's less relatable and it's less relevant to what they're experiencing on a day-to-day basis. Large numbers, such as the 30.6 million shown here on the slide, can allow consumers to think of the data as abstract and not really pertaining to them. So if you cut it down a little bit, you say, okay, 10% of Americans will blah. That's one thing, and that still works, and it'll get you there. But even better would be something like 1 in 10 Americans will experience this or that thing. So again, talking about relatability, reducibility down to numbers that people can digest and then take action with or do something about. And there's a human tendency for us to exclude ourselves from risk. You know, it can't happen to me, it can't happen here, oh, this will never happen. So again, moving away from abstract numbers like 75.4 million men and getting it down to half of men, that's a much more understandable and a relatable thing, and it makes it more real in the lives of the reader than the larger number does. So we did receive a question ahead of time from one of the folks that are attending our session today. So thank you to at A-Town Brown. Thank you for sending the question. And the question they ask is it more effective to type the data and numbers or feature them in graphics? And it is an excellent question. We're not here today to talk about infographics. We've already had at least one webinar on that. We'll probably have more, but let's touch on that for a moment. It can be a very, very effective way to push numbers and data out to people in an understandable and actionable way. For example, 1 in 7 people with HIV don't know they have it. Clear message, small number that's relatable, and visually represented by the figures in red, because if you count from the left over, the red one is the 7th one, and it continues across the banding that way. And then it gives you the action message following that. But the number, again, is digestible and real for people. Another one that's clear-cut. HIV diagnoses among African American women declined 25%. Boom, crystal clear. Now this is one that doesn't lend itself to being reduced to a 1 in 4 because we're talking about number of cases or rate. So using a percentage here is fine because they've limited the scope and made it a very simple, clear number that people can understand. So whether you're doing infographics or you're actually writing in text for web content or whatnot, as the questioner asked, yes, there's a place for numeracy and digestible numbers in both. So to be clear, we don't need the numbers to be so simple that they don't tell the full story, nor does the data need to be so dense as absolutely incomprehensible or understandable only by a very high-level elite, very well-trained group. We want the data to be just right, not too easy, not too hard, but like Goldilocks, just right. So the takeaways I'd like you to have from our session today are 3 fundamental things that you can do consciously and intentionally when you're creating content or sharing numbers and data through the products and channels that you use. Are the numbers and data accurate? Because accuracy, is the key to everything. If you don't give out accurate information, people are not going to trust you. So we can't sacrifice accuracy for simplicity. But are we conveying this in a manner or format that's clear to somebody that has only basic math skills? If it doesn't pass that test, you're probably not meeting a numeracy threshold. And ask yourself, does the way I'm sharing these numbers or this data persuade someone to healthier actions or to make choices that are going to take them from good health to better health? The other things I'd like you to think about after the session is over today is to think about with whom you're sharing the numbers and data in terms of intended audiences and then craft your message accordingly. I've focused today on consumers, and that's really what I'm speaking to. If you want the people in the area for which you're responsible at whatever role, position, or location you are, then you need to be able to share the information in a way that they can take in. You need to know before you start writing or sharing data what it is you want to accomplish. Do you want people to eat more vegetables? Do you want people to stop doing something else? What do you want people to do with the numbers? Because if you're sharing information just to inform, that's fine, but it's always more powerful to provide information that then provides an action that people can take to use that data to make their lives better. Think about the clarity or the complexity of what you're sharing. At that creative moment, it's a time to step back and ask yourself, do I really need to share this? Are people's lives going to be made better by me sharing this information with them? If not, then maybe you need to take another step back about whether you want to do the messaging at all. So considering then the impact of your sharing, are you targeting towards a population and you're helping them move towards something? Are you looking to drive people to look at your web content? Why are you sharing what you're sharing, and what is the impact of what you're sharing? And that is my presentation for today on numeracy. I know that went a little quickly, but it's a fundamental thing, and it's something we need to think about at that base level rather than itself being a complex topic.
Are there any questions in the room? Okay. Operator, can you check the phone lines or open the phone lines for calls?
Of course. At this time, if you have a question, please press *1 on your telephone keypad. You also may enter your question through the webinar by using the chat feature located at the lower left-hand corner of your screen or on your web console. Once again, if you would like to ask a phone question, *1, or you may type your question located on the web console. We'll pause for just a moment.
Okay.
And there's no phone questions at this time.
Okay, we have a call in the room.
Yeah. So thanks for, again, providing a nice presentation about literacy. So I'm coming in the context of consumer health information. Many patients, when they go to the doctor's office, they get the lab results, for example, blood glucose or hypertension and other things. One thing is just one-time results of showing what the ranges and reference ranges, plus some of these patients are chronic patients. They're going to have those levels, blood glucose levels taken over several months and to see the trends and other things. Mm-hmm. So what is CDC doing, or are there any efforts that being done, like for example, in computerized things, they can show easily the graph and do all of those things? Is there anything actually happening in the context of interpreting the numbers for their personal health?
Actually, that is a gap in my thinking about it. I did not think about laboratory results, things of that nature. I guess we could go to the very basic principles of it. The doctor should ask himself before talking with the patient, what do they need to know? What is the best way that I can demonstrate this to them? As you said, a chart, is it a chart over time showing them, hey, the medication you're taking is working, so keep on, or let's do more of that, that's great. But as far as CDC putting out guidance around how doctors should interpret and present information to patients, I'm unaware, but I would love to follow up on that and see if I can add that to what we save here and then share out afterwards.
Okay, thank you.
There are several questions in the chat. Sorry. Let me start with the first few. The first question is, we follow AP style guidelines for print, which call for spelling out numbers 1 through 10. I noticed your examples use numerals. What do health literacy guidelines say about spelling out numbers versus using numerals?
Well, I was not following the style guide on that, but yes, the heart of the question, or I should say the bigger part of the question, rather than answering that specifically, because I do not have, 100% honesty, I do not have the answer to say, address your question directly, but you do need to follow the style guide for whatever kind of product you're doing. If you're doing tweets, for example, you typically need to save space, and for clarity, you're going to use numerals. Where you have a longer format writing, such as web content, a blog, a story that is being pitched to a newspaper, then yes, you would follow the AP style guide, write out those single numbers, and then use digits for larger numbers. But again, I would suggest that there is an opportunity if we're targeting consumers. Again, talking to scientists, talking to other public health folks is one thing. I can say use 100,000 in a document, send it to my colleague, and they're fine with that. But if I'm talking to the public, I would want to take a step back and say, okay, how can I carve that number down to make it more digestible and understandable? But yes, I would say, speaking directly to your question, follow your style guide according to the channel or tool that you're using. It's going to vary by that.
Okay. We have another question from the chat. Do you have any strategies for dealing with odd units of measurement, like milligrams per deciliter, that people may not be familiar with?
I do not, because hopefully with a consumer, I would not be using deciliters or milliliters, sorry, distance versus volume. Hopefully, and this kind of harkens back to the question that I was asked about how to talk about numbers with patients from a clinician, I don't want to wade too far into their waters. I would just go back to the very first principle, that is, the simpler and clearer you can make it to a patient, the better. If you're talking about patient-facing, is that what I understood from the question?
Yes.
Yeah. Typically, I would hope that a clinician, and if we have an MD around the table, please feel free to weigh in, that you are saying you take this many of this pill this many times a day over this period, rather than getting into how many milliliters each thing would have. I'm seeing some nods around the table, so that sounds appropriate.
Okay. Our next question from the chat is, share with us how you best communicate health literacy concepts and numeracy with scientists who may not have had a tolerance for translating decimals into percents and keeping things accurate but not precise.
Well, that one's simple. Write it for them. It sounds humorous, but I'm actually being quite sincere. One of my experiences working as a health communicator was creating plain language versions of fact sheets. We had to have one that was appropriate for clinicians and one that mirrored it section by section for consumers. Now, obviously, there were a couple of places we would just leave out passages because they're far too twee or particular for the consumer, or the consumer just doesn't need to know it. And they're free to go look at the more complex page if they wish to. But the direct answer to it is that if you're trying to do that, you will want to have someone that has communication and writing experience essentially translate the complex, nuanced information into something that's simpler and cleaner. Then you take it back to that expert and say, am I saying what you want to say? And when they say yes, you've gotten done what you needed to do, because that is what we did. If you ever want to see an example of what I'm talking about, you can go to the CDC website, to the Division of STD Prevention, and go to the fact sheets page. And on that page, you will find detailed and plain language versions of all the fact sheets around the different STDs. And that's an excellent example of how you can translate higher order writing and complex concepts into simpler concepts in public health.
Okay. The next question, how do you know what is too technical? If the standard is subjective, then how can we standardize the level of simplicity in our publications?
Well, I'm not sure what publications you're speaking of, because if you're actually talking about peer-reviewed journals, then you're not going for plain language. You're going for specificity and high levels of accuracy and detail. If when you say publications, you're talking about public-facing fact sheets or web content, you're absolutely right. There is no bright line saying this is plain language and this isn't. But if you have taken plain language trainings, or what is that other training that we have? Clear Communication Index. If you apply principles from plain language or clear communication indices, they will tell you. There is even software that if you run your content through that, will tell you at what reading level the material is currently written, and can give you tips on how to make it more consumer-friendly and less technical. But yes, there's definitely not a checklist which will tell you this is too technical or is not, but you can work towards that based on those principles and the tools that are available.
Okay. The next question, do you have any advice for genetic conditions and numbers? Some of the patients are confused by stating 1 in 4 chance of having a child with sickle cell disease. They often think that they can have 4 children and only 1 will get the condition.
I'm actually sitting here thinking about an article I read not long ago about how people misunderstand what odds mean. And there's a tendency to think it's the hot hand problem. Just speaking like if someone is playing cards, they think because they won a couple of hands in a row that they're going to continue winning. Or if they're losing, they're going to continue. When each one is actually typically a completely independent, separate event. So giving the number 1 in 4 to a patient, there's nothing wrong with that. That works just fine. It's perhaps taking that next step of explaining that, okay, each child has a 1 in 4 chance. So how you phrase that can be one way to clarify that the misunderstanding. And again, that does harken back to one of the first things I said is we cannot expect our patients to understand. We have to make sure they understand. When we are creating the language, we should be writing to ensure that a person understands what we're saying and not assume that they have anything more than the basic checkbook balancing skills and the ability to read a thermometer or something. And I'm not condescending in saying that. Math is not the first and most important thing for most people that live in this world. So getting as close to meeting them where they are as we can is going to get us closer to helping them make better decisions. And I could totally see how somebody would get to that. Okay, I've had 3 kids, so that means the 4th is going to have sickle cell, so now I can't have another kid. That's a deeper conversation. But yes, how you frame that, the context in which you give them that information is going to go a long way towards helping them understand it correctly and avoid those sort of misunderstandings. Excellent question. I love that example.
Okay. How can nutrition and exercise information be communicated and displayed, especially in the context of changing nutrition labels and the increasing use of Fitbits, pedometers on phones or otherwise?
Not really sure what the question is, Matt. Can I hear the question again? Because there's a lot there.
Yeah. How can nutrition and exercise information be communicated and displayed, especially in the context of changing nutrition labels and the increasing use of Fitbits, pedometers on phones and otherwise?
You know, I don't mean to dodge the question. I'm just going to have to say, without knowing the specific example of the information, I really can't give advice, because if we're talking rates, if we're talking volume of intake of a certain kind of food or nutrient per day, I mean, it's going to vary widely. If you'd like to reach out to me offline, my CDC email address is pbh3, that's Papa Bravo Hotel 3, @cdc.gov, and we can correspond about that. I'm not a nutrition expert, so please don't think that, but we can talk.
Okay. Our next question is, can you share some specific examples of making numbers digestible for consumers?
Well, I actually kind of did that during the presentation, but again, you have my email address that I just gave out, and it's going to be in that. So if you'll write me offline, we'll talk about that further and deeper than we did in our conversation today. But moving towards, and I know that a lot of times hearing the phrase the lowest common denominator can be a pejorative. We're not talking about writing at a low level. We're talking about, and this is a principle you can apply to go ahead and start that conversation, what is the lowest possible denominator you can get the number to that is both accurate and understandable? And let's go back to, if we say 75 million men. Well, if we assume there's about 300 million people in the country, half of them are men, then half of men would be around 75 million. So you can just boil that 75 million down to a relatable half of men, or 1 in 2 men, if you want to go that route with the language. So that is where you start with the number and think about how can I reduce it down to a small enough size where people can digest it while still keeping it accurate. Never sacrifice accuracy, because then you sacrifice credibility and you give people bad advice by accident.
Okay. We have another question. Do you have any guidance or best practices for communicating numbers to adolescents or younger audiences in the context of infographics or other materials?
As I noted, infographics are outside really the scope of this today. I was really tipping my cap to them, but I'm turning to one of my colleagues here at the table, Mary. We had a webinar some fairly short time ago on designing infographics. Am I remembering that correctly? Okay, well, hopefully we'll find a way to share out the URL, because that webinar has also been saved, and you can go back and view that, and they can answer your questions in depth on that, and you can reach out to the expert that did that webinar. I don't want to give you incorrect advice on a topic in which I'm not an expert.
Okay. How is it best to describe rates to consumers? X in 100,000 as an example.
Harkening back to one of the slides in the show, one, I'm not going to talk to a patient about rates. having been a disease intervention specialist and worked in the field talking with patients on a day-to-day basis for many years, a lot of what I'm talking about today I actually practiced when I was talking with consumers myself. I would never sit down with a consumer and say, you have a 1 in 100,000 chance of what have you like that. I would find a way to make the number, again, 1 in 4 or whatnot. But again, I would actually stay away with rates. If we're talking about one-on-one with an individual, it's all about how they make their choices and the choices that they make. Rates are not relevant to an individual person. It's their set of circumstances, the life that they're stuck in or living, and the choices they're making that are going to drive what happens to them. I guess on some very fundamental level, if a person is part of a population or subpopulation, they may be at more or less risk for hepatitis or name this condition. But I think it's far more important to get down into the nuts and bolts of that person's life to assess what their individual risk is than to talk very high-level risk based on their identity. Just to digress for just a moment to give an example, way back in the early 90s, before we had effective treatments for HIV that could give people a good quality of life, I had a young man come in. I was counseling him around HIV testing, and a standard question was always to ask people, what made you decide to test today? Why did you come down here to request a test? Not challenging them, but just inviting a conversation to do risk assessment. And he looked at me as if I were a fish in a bush. It's like I was absolutely mad. And he said, well, I'm gay. Of course I'm. And I'm like, no. It's not like that. The number of partners you have, whether you have unprotected, rectal sex or whatever, whatever your risk profile is, that determines it. Not who you are, not your identity and you just as a human being. So taking it to that level and talking with a person is going to be far more effective than citing a rate that's not necessarily meaningful to them in their lives. I hope I didn't over-answer that question, but I think it's a very important point.
Okay, here's another question. Those with low health literacy may struggle with understanding the timing of preparing or discarding their medications. What would be the recommendations when presenting information about time? I know people struggle with fractions. In this example, 1 and 1/2 hours versus 1.5 hours versus 90 minutes. What would be the best way to present this example?
What I would recommend is, again, simplicity. Pick an hour of the day. Because people have, I know some people have disorganized lives because of mental health issues or other things. But for people that have organized lives and can follow a med schedule, setting a time rather than an interval, I think, would probably be much more effective. Take one at 9, 10, and lunch and noon, and one at 6, 7, and 8 tonight. Do that every night, and you're good. Whatever the interval, would work out to be on a clock, and that can be negotiated with the individual patient because people work different schedules and people are awake at different times. But staying away from intervals, because what you're asking a person to understand when you give an interval, you're asking them to think about a negative. You're asking them to think about a gap. Instead, if you ask them to think about a fixed point in time, then that's easier to put a pin in and say, okay, well, it's 9 o'clock, I know I'm taking a pill, period. Instead of having to say, well, I took one at 9:30, and he said don't take one for another hour and a half. So is that 10, just take that away and give a firm pin in the wall time. You'll take them at this time, this time, and this time, and that gets you out of that entire conversation about them having to do calculations of gaps between medications. I'm not a doctor, so please don't take that as any kind of medical best practice. But to answer that question, that is how I would address it.
Okay. Do you have data on the health literacy level of state health officials or other populations?
No.
Okay. Do you utilize any human-centered design in your conclusion about what is best for dealing with principles of numeracy?
Honest answer to that is no. This is experiential. But that is worth me putting a note down and incorporating principles of human-centered design into my recommendations. Thank you. That's an excellent addition.
What is the name of the software that runs plain language? Oh.
Mary?
The software we use here at CDC is called Visible Thread, and it can can put a document through the software, and it can tell the audience level, if it's 8th grade, 10th grade, 12th grade.
So it's visible thread?
Correct.
And is this free or is this pay?
It costs money. Yeah.
Okay. So if you'll Google visible thread, you'll be on the road to finding that. Thank you, Mary. That was Mary Cash, and she is our health literacy lead for this center.
Do you recommend setting up a criteria to determine what is important for people to know? Since we serve multiple audiences at once, it may be difficult to decide what to share or not to share. What not to share is difficult. We need to be transparent as possible with the information we have available.
I agree. And again, as with so many things, there is not a bright line of what you should or should not share. That's actually going to be a negotiation between you and your content owner. Here in CDC, that would typically be a subject matter expert or scientist of one sort or another. That we would talk with them about, okay, in your opinion, you were the author of this article, or you're the person who's responsible for this surveillance report. What are the 3 top things that people need to know, whether they are clinicians for treating patients, whether they are consumers for making their lives better and healthier? And typically, most things are going to have multiple audiences. So we typically will write, if we have singular products like a fact sheet, that may be a consumer-facing fact sheet, in which case, we're writing plain language and using numeracy principles. If we are sending out, for example, a Dear Colleague letter to other public health leaders and clinicians from our center director, it's typically going to be written at a higher, more nuanced level of writing because we're dealing typically with a more sophisticated audience, even though I don't have the data to back that up. My experience says that's true. So tailoring for audience first, and then your organizational priorities are going to be right up there with that. What do we want people to know to further what we're trying to accomplish, whether that's disease intervention, nutrition improvement, whatever your topic may be. But you also, if you're fortunate enough to be able to write multiple versions like the STD fact sheets I described, or for example, if you're doing social media of any kind, Twitter, Facebook, or whatnot, you can be very specific and intentional in how you write the information. You can start as base as saying consumers, or however you want to get public-facing stuff to make it clear that you're targeting the person on the street and not clinicians. Or you can simply place it in a channel that's appropriate for that. If you're looking at something consumer-facing for African Americans, we would often go to somebody like the website Black Doctors Online, or BDO, because we're trying to reach that population. We want the information to be consumer-facing. We know the consumers use that site, so we go there with that information to target that audience to give them the information they need. So it's very much about taking the time and planning where and how you're going to share the information. And dealing with transparency, absolutely. The information that we have and that we share out is typically a small piece of a larger document that is either it's a strategy document that's published online, it's a scientific article that's in a peer-reviewed journal, it's a fact sheet that we've published on our or a friendly website. So yes, it's definitely not some hidden place where there's information and we're only sharing out tiny little bits and nuggets as we choose to rather than to help people. We are smart and selective about our messaging to have the most impact and to reach the most people regardless of the audience.
What is the name of the program or website that has the ability to tell you the level of clarity or reading level your document is rated?
Viral Thread.
No, visible.
Oh, the different one?
No, it's the same one.
You're talking at the same time. I can go on to the other.
It's called Visible Thread.
Yeah, what did I say?
Viral.
Oh, viral? Oh, my God. I'm getting punchy. I can tell that. So Visible Thread is that software again. Google that.
That we have used here at EPA.
Right, and there are other products out there, but the one that we have been using, we are not endorsing or recommending a particular product. We're simply giving you an example of a kind of product.
Yes.
Okay. We just have a few questions left. I know that this is not a graphics talk, but do consumers understand horizontal or vertical bar graphs better?
Again, it's all in the subject matter. But yeah, if an uncomplicated bar graph, and I'm just riffing off this. This is not expertise. This is just my experience. So take that for what it's worth. a simple bar graph that has a minimum of 3 data points where you can identify a trend, see something's going up or going down, can give great clarity, but it's according to what's presented in that. If it's rates per 100,000, not so much. So it's all according to the data that you're putting into the chart, the clarity and comprehension that comes out of it. So the answer is maybe, possibly, depending.
Okay. Oh.
We have a question in the room.
Yeah, so I think you mentioned in your presentation about the context, actually.
Yes.
So the context, I think that's what I wanted to know about. Like, for example, people from other side of the country, like not from here, like East, they are more in the different units of measure. So they are much more related to the centimeters than inches. Same thing with the distance, how much you walk, whether it's miles versus kilometers, and liters versus gallons, and those sort of things are there. So in the communication fact sheets and other stuff, do you recommend using both of them, or like one in brackets, or just using one?
Gotcha. The question is, when we're talking about how we share numbers and data, do we want to use multiple systems of measure, whether it's U.S. tons versus British TONNE tons or whatnot? And that is going to be audience dependent. If, let's say, it's Dr. Merman's Twitter feed, and we're pushing a message out to the United States, we're typically going to use whatever numeric system is commonly used for that subject matter in this country. We're cognizant that we have a worldwide audience. About a quarter of his followers, for example, are actually outside the United States. But it can get confusing to people if we start putting in 2 different systems of measures. So our real focus is on the domestic audience, and we love you overseas and wherever you are, but we have to take care of the audience here that we're responsible for providing better public health to. So whatever the appropriate, like if you're talking about medications, that's going to have a particular language around it. If you're talking about number of persons experiencing a condition, that will be a different language. But they would all be used in the language that is associated with that particular thing. Like if you're talking medications, you would use milliliters and whatnot because that's what's used by the medical community here. But if it's common language kind of things, we're going to default to whatever we use here in the United States as opposed to being inclusive of other countries as well. Just simplicity, keeping it smooth.
Okay. Another question from the chat. Could you share some more examples of common mistakes you've seen that even the most seasoned professionals and presenters have made and how to improve them?
That would require speculation on my part, which I really just can't do off the cuff here. If you'd like to have a deeper conversation, again, my email address is pbh3, that's Papa Bravo Hotel 3, @cdc.gov, and I would love to continue that conversation. I emphasized the positive in the presentation. I didn't bring up, don't do this, because I want to move towards do more of that. But sometimes, as somebody asked in an earlier question, where's the bright line? Where's the clear divider or marker? And there isn't always one. So if you yourself are a health communicator, talking with your subject matter expert will always improve your conversation that you're trying to have with the consumer. Or if you yourself are a scientist, find you a health communicator, and the two of you together will be able to get where you need to go. But if you'd like to talk in more depth about that, please reach out to me, and I'd be happy to.
Okay. How do you best communicate complex numbers to teenagers?
This is similar to an earlier question. I will just go to the fundamental thing. Clear, simple. If you go with those 2 things, that the number is not complex or obtuse or hard to digest. If it's a simple decimal, if it's a simple 1 in 4 or a small enough number, it's going to be relatable for a teenager. As a matter of fact, teenagers may actually have a leg up because teens are currently studying mathematics somewhere, whether they're in junior high or high school, whereas many of us adults, raising my hand, haven't touched a math course in 30 years. Stats class that I did not do well in was the last time I had a math class, and that was about 1989. So you may be actually surprised at just how well teens can understand things. But I would add, it may be even less about the numbers and more about framing and context. If you work with the teen to help them understand what you are looking for them to do, then the numbers simply add onto that and build atop it. So your framing and your clarity and message of what you want them to do, stop doing, do more of, or do less of, is going to be as or more impactful than the numbers that go with it, I would suggest.
Okay. Right now we have 2 more questions. Did the infographic webinar happen? I thought it was canceled.
Mary?
So we did have one planned for September of 2017 that was canceled, and it was rescheduled for June, so last month, but we can send out the information on the webinar.
Okay, so it was canceled last year, but it happened this June.
Correct, so I'll get you that information.
Okay. It seems like we're moving toward a Twitter-sized world. How do you communicate with authors the value of being brief?
Well, you use the magic word, communicate. You talk with them. That's what you do. I have a lot of experience in this because we often will take peer-reviewed articles in scientific journals that are of interest to our Twitter profile folks, such as Dr. Jonathan Merman or Dr. Hazel Dean or others, and say to them, this is important to the division, it's an important message that people need to hear, and we're going to work with the scientists to ensure that we get the message right. So I would then read the article or the abstract, but typically it's better to read the entire article, because there are things often you'll find in an article that are not in the abstract or whatever lengthy document you're reviewing. Write up what you think the pertinent takeaways are, then sit down with the subject matter expert and have them say, yes, that, or no, this, and then you will have your message ready, and it will be consonant or agree with the messaging that's being given in the original document. You will also have the stamp of the subject matter expert saying that, yes, this is a better way of encapsulating what we're trying to say without getting into too much nuance or down into the nitty-gritty details that actually will obfuscate or make less clear than what we're trying to do.
Okay. That's all the questions from the chat right now. Operator, are there any calls on the line?
No one entered the queue today.
Okay. Well, unless you have closing remarks or anything else?
Only closing remarks. I will make our first. Thank you all very much for attending. This is something that matters very much to us, and we are continuing to make more prominent in the work we do, and I hope that will for you as well, and I hope you found this useful. And anyone that wants to reach out to me through email, I will be more than happy to continue conversations offline. And thank you to my colleagues for being here to provide information about some of the other products and prior webinars we've had.
Okay. Well, thank you for joining today's webinar, and enjoy the rest of your day.
And with that, ladies and gentlemen, this does conclude your call for today. We do thank you for your participation, and you may now disconnect.